Hello, my name is Dylan Hoffman, and I am a first-year student in the Indiana State DAT program. And today I'm doing a reflection on kind of my approach to a systematic evaluation, and I'm going to look at a case and kind of break it down. So looking at a case where I think my systematic approach wasn't too great was with a 14-year-old female athlete. This was about 6 months or so ago. And she reported with low back pain that had been present for several weeks at that point. The patient had a pretty excessive lordotic posture. A quick screening of the mobility, spine mobility, showed that she had a lot of motion in her lumbar spine, especially with extension. And at that point, I started to think, okay, this is likely a hypermobile type of injury. Went through my evaluation, did perform kind of the prone instability test. That was positive, and so based on kind of my thoughts and assumptions at the time, okay, I've seen this before, I know how to treat this, and I jumped straight into treatments to increase dynamic core stability and work on posture re-education, talking about sleeping positions, those sorts of things. And I think all of that treatment was great, but what I failed to do was dig a little deeper and say, is this just a general hypermobility, or is there some kind of structural damage? The patient wasn't very compliant in coming in. She was a multi-sport athlete, and she continued to play the sports through the rest of the year and would only come in when she was in a lot of pain. And then we would do some treatments, and I wouldn't see her for a long time. So showing up was an issue with that patient. And then eventually we find that she, over the summer, went to a physician and was diagnosed with grade 3 spondy. And so that's definitely an evaluation and a thing that made me sit back and say, should I have had a better system of potentially seeing those factors that were leading to spondy and sending that athlete to a referral sooner than later. And so I think kind of looking back and assessing how I worked and reacted there, I need to look at the fact that I didn't really use a clinical diagnostic algorithm in that. And looking through the literature and the things that we've been talking about in class this week, I see that if I had had more of a structured diagnostic algorithm to work with and work within, I could have removed some of my own biases about and some of my assumptions about what it was and the severity of her hypermobility, and I could have potentially seen and understood the importance to refer instead of the patient going a long time without that and eventually having to go over the summer and see another provider to get that diagnosis. I think that this could potentially, most of these cases I've treated that way and I've had success and the pain started to go away. But it really did make me question, am I not working within a system that's actually going to help me catch those red flags and figure out when should I refer? And so looking at best practices, looking at here's these cluster of tests that I can perform to better understand when I should take a patient and when rehab at the athletic training facility is appropriate and when rehab at the athletic training facility is not adequate enough and I need to go ahead and refer to a physician. Obviously, I don't believe that every low back pain should be referred, but I need to be utilizing an algorithm that gives me some structure to know at what point do I refer. And there's examples of this. You see examples of this with the Ottawa ankle rules, right? This is a clear clinical guideline that lets me know I should refer this time and I don't need to refer this other time, and I need to dig more into the literature and find those clinical algorithms for when to refer patients in other aspects than just the ankle, looking into injuries to the spine and low back as well, especially with the low back being one of the more prevalent injuries that I'm seeing in my practice. That's my reflection, kind of going over a case and how I think a systematic review could have helped improve that.